Thank you for joining us. My name is Gladys Gachanja and we're coming to you from the Grammar Suites here in Nairobi. Tuberculosis, or better known as TB, is a great health concern not only globally but also here in Kenya. And actually, according to statistics, it is the 5th leading cause of death. So the question here is, as much as we've made great strides as a country to curb the burden of TB, how come we have over 29,000 people succumbing to this condition? We answer that question and many more in today's episode. But before that, here now is a fact of the matter. Tuberculosis, or TB, is a potentially serious infectious disease that mainly affects your lungs. The bacteria that causes TB are spread from one person to another through tiny droplets released in the air via coughs and sneezes. The two types of clinical manifestation of TB are pulmonary TB and extrapulmonary TB. In Kenya, according to the first post-independence prevalence survey, it estimates that about 40% of active TB cases remain undetected and unreported. This has greatly contributed to the spread of the disease and the rise in cases of drug-resistant TB. TB can be treated and cured, but if not treated properly, the disease can be fatal.
I'm Jacinta Wanjogo. I'm 26 years old. I'm married. A mother of one kid. 2018, from October, now things changed. I started a pain at the lower stomach. We went to North Kinangop Hospital. It's a mission hospital. I went to the physician, of which he sent me for MRI now. The good thing, after MRI, the results came. The doctor said it is TB. I really cried because, for me, I knew TB. If you have TB, you have HIV, you have STIs. I cried. And now I accepted myself and started taking drugs. Let me say it's not an easy journey, especially if your parents are not supporting you, and if you're married, your husband is not supporting you. And us, we have to accept ourselves, because when you don't accept yourself as, now I'm sick, I have tuberculosis, if I won't take this medicine, I will give it to affect my husband, my baby. And I have a small baby. Even me, I thank God, because those medicine, it's not easy, but because you know what you're going, what the result of the medicine, I had to take. Yeah.
Well, they say TB in a Tiba, but the question here is, why are we still seeing deaths associated to it? We try to answer that question and many others on this forum, and to help me do that, Eddie Chichi, who is a TB survivor and advocate of the same, and Dr. Elizabeth Onyango, who is the head of the National TB Program. Now, Dr. I'll start with you. TB, as we know, is contagious. It's normally spread by droplets of saliva when somebody coughs or sneezes. But then again, just reading on it, there is a type of TB that is not contagious. So help us understand the difference between latent TB and active TB.
When someone inhales the TB bacteria, what happens, we have the defense mechanisms in our bodies that try to contain the bacteria, so such that if your immunity is strong, then those the immune cells will try to either destroy or to contain them. So when they are contained in such a manner that they do not multiply further in the lungs, because TB primarily goes to the lungs, then it can remain dormant like that for a long period of time, and that is what we call the latent TB infection. For this, there are no symptoms. You are not sick, and you're not able to spread the infection, rather the bacilli, to other people. But in the event that immunity is compromised, then the TB that bacilli that was inhaled continues to multiply, and this shows itself in form of symptoms like cough, yes, weight loss, fevers, night sweats, which are drenching. Then this is what we call the active TB disease.
So for you, Eddie, I mean, it's been years free of TB, but the journey for you to find out that you are actually carrying it took a while. What symptoms were you exhibiting?
I started by coughing and now visiting private facilities without being examined. I was put on strong antibiotics, always with injections. Then
so what would they say it is? A bad flu?
Pneumonia. That's what they were talking about. They were treating pneumonia, but without tests or nothing, So this went on, I think, for 8 years. That when I was advised by my mother, I went to Port Reitz Hospital. By then, it was the only facilities treating TB in Mombasa. So they did an X-ray, and it showed that I have TB.
All right, now Dr. taking you back to the two that you differentiated for us, the latent and the active, does it mean you can live with it for the rest of your life without knowing you have it?
It is possible to do that. In fact, most, they say a quarter of the population, of the world population, have latent TB, which they are not aware of. But as long as your immunity is strong, you can live with it for life. But if your immunity is compromised, especially for children who are less than 5 years, the immunity is not well developed. So you find from the TB infection, they progress now to active TB.
What other risk factors also put you at crossroads with TB?
Uncontrolled or unmanaged HIV/AIDS puts you at heightened risk of developing TB. Of course, malnutrition also is a risk factor for developing TB disease. Other conditions are like diabetes, alcohol, smoking, patients who are undergoing like organ transplant because of the kind of medication they are put on.
Chichi, you went and you found out that you had TB. What TB did they tell you were suffering from at this point, because it was 8 years later?
Yeah. It was pulmonary, they said. I was put straight on injections, 60 injections, and oral drugs. Injections for 2 months. Then they changed on to continuous phase. But there was no health talk given, no counseling, no nothing those times. It's just dawa, you go home.
Now, there's pulmonary TB and there's extrapulmonary TB. What is the difference and how does one progress to the other?
So pulmonary TB is TB of the lungs, and primarily the TB bacteria affects the lungs. In the event that the immunity is compromised, then they overwhelm this defense mechanism. They spread to the lymph nodes. Then after that, they spread to the rest of the body. So we say that TB bacteria can affect any part of the body, can affect the kidney, can affect the bones, can affect the brain, except we always say except the nails and the hair. So TB that is outside the lungs is what we call extra pulmonary TB.
Now we know how sensitive the TB can be when it comes to being contagious. Did they isolate you? Did they admit you?
The time I was put on treatment, no isolation. Have your drugs, you go home. No dots, no nothing. So if you throw them, it's your problem.
But what are some of the measures you put in place to ensure that you did not affect those around you?
I knew nothing about the spread, and but I think the main thing which made me not spread it is because of my love to the hospitals. You understand, the drugs.
All right. Okay, Dr. Tell us some of the precautionary measures that you can put in place to ensure that you do not affect or infect other people.
We encourage that people avoid crowded places, need to improve ventilation. So what we do in our health settings, so we institute what we call the infection prevention measures. Open the windows. One of the prevalence survey that we did, actually the first one post-independence in 2016, revealed that there are a number of people who may not have yeah, the TB, the classical TB symptoms, they cough, the what, but they have the TB disease. Yes, so what we encourage screening. As you go to a health facility, be screened for TB, and this we call active case finding. This is initiated by the healthcare worker. Then once these patients have been identified, they are sent for diagnosis. Yes, we have molecular diagnostic tests, what we call the gene expert, and it's slightly expensive, but the good news is it is free of charge because the government has paid for it, also through support of Global Fund. So
and this is only in government facilities?
All facilities, even private facilities, they are able to access this. And once we identify those who have the disease, again we have to ensure they are put on treatment. Yes, treatment. If it's drug-sensitive TB, I think we'll explain that later.
Yeah, we'll get to that.
Yes, drug-sensitive TB, they are put on treatment for 6 months. And they have to adhere to ensure they are treated so that, again, we don't spread the disease to other people.
Those around you, when they had that Eddie had been diagnosed with TB, what was the reaction?
Nobody knew, because by then I was still working as a DJ. I'm a DJ by profession. I'm a scuba diving instructor. So I used to do this. So before, I had no information, so I kept it for myself. Nobody knew I had TB.
Apart from your mother?
My mother, even my mother didn't know. And so I never used to go to her place.
Yeah.
I was staying in Diani, she is in Mombasa. But I never missed an injection and swallowing the pills. The problem is they never worked because I've already developed resistance.
Now, Dr. they say you're more likely to get TB from someone you live with or you work with than from a stranger. How come?
We say you have to be in close contact, and it's airborne. So someone has to release the bacteria from the lungs, and depending on how close you are, then you are able to inhale. Or when we do what we call contact screening, somebody who has active TB, has been diagnosed with active TB, we want to know who do you stay with, who do you spend most of the time with. Then we call them, we invite them to come to the health facility, and they are screened for TB, just to ensure that they don't have. But for children who are below 5 years, even if we find they don't have any of the symptoms, we have to put them on latent TB treatment.
Okay, now we take a break at this point, and when we come back, there's a lot of stigma associated with people living with TB. Now, Eddie will give us an example of what he went through or some of the cases you've come across, and of course we'll be expounding other matters concerning TB right after this.
For a better tomorrow, don't forget to do the 1, 2, 3 with Colgate every night.
Look how happy my baby is. I tried different brands, but now I've discovered the world-famous Molfix and saw the difference. Let's see how absorbent Molfix is.
Molfix, thanks to its ultra-absorbent particles, can keep more liquid than the other diaper brand, so you can use it comfortably all day long.
All babies deserve a high-quality diaper. You should also try Molfix.
This is NTV.
Jioni njema mpenzi mtazamaji, popote ulipo, zulia jekundu limeisha tandikwa kona moja hadi kona nyingine, ishara tosha kwamba maandalizi ya NTV jioni yapo katika lahadha za mwisho, na tuna mengi zaidi ambayo tumekuandalia jioni hii. Hivi ni vipasho tu kwa sasa.
This Easter. Sell one car if you have 3. Forgo have your savings. Give the fuel money saved to assist a house help. Half of your meat portion to give to the needy, but without camera.
Sikukuu ya Pasaka yaadhimishwa kimya kimya, huku mahubiri yakikemea kadhia ya tamaa na ubinafsi katika jamii.
Sasa tunaomba mafuta ishukishwe ili at least sisi tupate kitu kidogo. Juu sasa unajua huwezi ongeza mtu bei ya mzigo.
Watu 6 zaidi waambukizwa corona, huku Wakenya wakidai kinachowaua sasa ni bei ghali ya petroli.
Tusiache watu waumie, na tuko na uwezo ya aidha kufikia marafiki zetu ama tuko na uwezo wa kuwasaidia.
Familia za Kibra zaibuka na mpango maalum wa kustiri wasioweza kukidhi mahitaji yao muhimu katika jamii wakati huu mgumu.
Wear mask, my friend. Wear mask.
Na mbunge pamoja na watu wengine 16 walala seli za polisi Ruai kwa kuandaa karamu kinyume na kanuni za afya. Naam, mtazamaji, bila shaka ni kionjo tu, mengi zaidi ni hapo saa 1 kamili. Wasawa mimi na wewe kuwa pamoja kwenye meza ya NTV jioni papa hapa ndani ya jengo madhubuti kabisa, jengo la Nation. Mimi ni Salim Swale, weka miadi nami.
You spoke, we listened, and now every weekday at 6:30 a.m. you can join Evelyn and Peter to get your daily fitness fix. Some booty exercises and some dancing, while at each you could even lose some weight. Get moving, we guarantee you will love it.
Now more than ever, you need to be abreast with the daily happenings wherever you are. Get the Daily Nation e-paper with a free COVID-19 newsletter at a special highly discounted rate of Kenya shillings 500 for a period of 1 month. Daily Nation. News anytime, anywhere.
In the wake of the coronavirus pandemic, life is increasingly becoming tough.
Njaa ndio itatuua wengine, hata si corona.
Nilitoka kazi, kapata landlord amenikatia mlango.
Massive job losses.
Tumesimamishwa kazi.
Mzee amesimamishwa jobs. Business is slowing down or worse, shutting down.
Kazi haiko sasa, lakini sasa ni kuzunguka tu nikitafuta polepole, hata angalau kama naweza pata kama 20 ni kule.
Mimi saa hii nipate 200, naweza nunua chakula. Ukinunua sanitizer na ununue mask, sio pesa itakuwa imeisha.
Welcome back. Our conversation today, tuberculosis, what is known as TB, and still talking to Eddie, who is a TB survivor and advocate, and of course Dr. Elizabeth Onyango, who is the head of the TB program Kenya. Now, Eddie, the stigma that comes with TB. Speak on your experience.
Nobody knew I had TB, but they referred to HIV. I was infected by HIV, so...
Okay, help me understand. If they didn't know you had TB, why did they think you were HIV positive?
Coughing and coughing, that was my mark. Wherever I'm passing, people knew this is Eddie passing. And now, you know, I was 78 kgs and I went down to 37 kgs. Being empowered, I realized that stigma is the one which causes a lot of deaths on people with TB. Second, it's the stigma is the cause of why we are having a lot of cases of TB. Because if I come out like what I'm doing now, always come out on media and you know, in facilities, in schools, I go talk about TB. If all of us do the same, you know, and I mean all treated patients, plus not only patients, even you can do this. Yes. You understand? We can fight this TB.
Now, Dr. Harry, the relationship between HIV and TB, you mentioned it's one of the risk factors, HIV, that exposes you to TB. But now with the rate of HIV new infections going down, has that now helped with the fight against TB, or has the dynamics of the same changed?
As Chichi said, there's usually this perception that if you have TB, you're likely to have HIV. But statistics show otherwise. Because according to our prevalence survey, the one that we did in 2016 for Kenya TB prevalence survey, it showed that 83% of the people who had TB were actually HIV negative. Yes, we always relate it to when the TB cases started rising with the advent of HIV. But currently, if you have HIV, if you have HIV/AIDS, you are put on antiretroviral drugs, and that suppresses the virus. It enhances your immunity. So we are finding fewer and fewer TB cases among the HIV positive population.
Now, we've been talking about drug-resistant TB. I think at this point, let's now unpack it. For you, Eddie, you said by the time you were getting the proper treatment, you were already there. What kind of treatment did you go through, and what did this mean?
Things got worse. Then I had to migrate from Diani Beach, went to Mombasa, Toys nightclub. I did music for four months. Then people were talking a lot. Said, let me quit. Then I had to go to Voi. Voi is where my grandmother is. So I went there, and the next day I went to Moi Hospital. It's a public facility, referral on that area. Then I went to the TB clinic. I met Dr. Musia, very, very kind person who walked with me through this journey. So it's the first time I did sputum test, and he showed TB. I was put on injections again, but now they were compressed, RHZD. I took those drugs and a continuous phase. When I did again sputum, it shows it was like that. I still had TB. So he started suspecting that I had, maybe I'm resistant. He was advised to use to combine an antibiotic called Spafloxacin, of which he did. But they were too costly, a week spending like 12,000 this time. So I did this for 5-6 months, I think. When I did another culture, it showed that now resistance is gone, fight TB. I said, hallelujah.
Good news.
We continued until 2006. When I did another culture, now results came and showing that I was resistant to all the TB drugs now. You see.
So how long did it take before you were clear of TB?
I went long, 2011.
All right, quite a lengthy journey. Now, Dr. Harry, just listening to him, he just represents now what you were saying, the report that said 40% of TB cases are still unreported and undetected. And this is what is also feeding to the burden of TB in the country. Explain that.
What we currently know, the number of TB patients who are actually diagnosed and reported in our national reporting system are 60%. 40% of TB is out there. It could be in our houses, in our places of work, in our schools, but it has not presented itself to the national reporting system. We have even, we say almost 3/4 of our patients who even attend our health facilities, they are missed, they are not diagnosed with TB. But even if you are not reported into our system, that means you could be treated but not using the conventional medicines that have been prescribed. And that means that TB might not be cured.
Just looking at a report, actually the Global Situation and Trends report by WHO in 2017, it said there were more men diagnosed with TB. Eddie, what is it about men that makes them more susceptible to TB?
They keep themselves in the clubs where it's dark night time. TB but survives, isn't it? On a dark area.
Oh yeah, TB bacteria does not like the sun.
No, it doesn't. So you see, that's the challenge. And another challenge with men, they don't go to the hospitals. And the diet they take, most of them are on gauge, beer and whiskey, you see.
Yes.
So their immune system is down, you see. Okay. That's the reason. After treatment, like I'm surviving with only 48% of the left. The right is gone.
The left lung?
Yeah, the right lung is gone. I don't know. You see. Mm-hmm. So I think the thing which keeps me alive is love to the hospital.
Now, TB is a 5th killer in Kenya, and we cannot brush that under the carpet. Daktari, in your line of work, what should the health stakeholders do to help along in the process of curbing the burden of TB?
TB, as we say, is not a one-man show. We need multi-sectoral approach in fighting this TB. And one of the key pillars is that we have to come up with both policies and supportive systems in order to fight TB. And that requires political commitment. It requires resources, resource mobilization at all levels. We need resources that can help us fight this disease. Treating TB is not easy. As we said, even the diagnostic test, one cartridge costs around over $10, that's around 1,000 shillings. And you may need to screen or even to test around 20 to 100 people to be able to get just one TB case. And even putting those ones on treatment is not easy. TB treatment is free in whatever hospital you go to, be it private or public. Yes, I know it is long course. It takes almost 6 months to treat drug susceptible TB, that one that is sensitive to the first line drugs. For MDR, multi-drug resistant TB, it takes a bit longer and it's more expensive. It can cost even 200,000 to treat just one case of drug resistant TB. The good news is that is supported by government. Yes, so, and we have to ensure people adhere. If you're diagnosed with TB, adhere, and these people have to be supported. It is not easy taking drugs for all this long, so they have to be supported.
For sure, for you to be here today, TB in Atiba.
Kabisa.
But what would be your clarion call to Kenyans in as far as identifying TB and getting the right treatment for it?
They should come out, whoever is affected, both infected and affected, come out and let's talk about let's speak one language, TB language, to end it,
Yeah. And we say again, TB?
Iko na tiba na TB inatibiwa na tunataka kumaliza TB
kabisa. That's a very good challenge, and I think we can end that conversation on that note. A challenge to those that are stakeholders in the health sector and just leaders in general to take the front line in helping curb TB in this country and globally. I have been speaking to Eddie Chichi, who is a TB survivor and advocate, and of course Dr. Elizabeth Onyango, he's the head of the National TB Program. Thank you, and it's now time for the health tip.
Lie down slowly, pick the weight from there, not too narrow, not too wide, somewhere there in the middle. Then bring it below your chin there slowly, okay? So you work on your pec muscles, and make sure when you're doing this also, you don't pull your elbows out. Your elbows should be locked in. The distance between your body and your elbow should be 45 degrees, not 90 degrees, okay? Your form has to be the right one for you to achieve what you want to achieve.
Again, TB in Atiba. A great conversation today, and if you'd like to get in touch with the National TB Program or Eddie Chichi, who is a TB survivor and activist, please reach us on our social media handles and we'll hook you up with them. Well, it has been Health Diary. My name is Gladys Gachanja, and we've been coming to you from the Grammar Suites here in Nairobi. Till next time, see you. Okay, so do you still do the DJ work? or you retired? Mimi, I am at my back. That question and many others will